Postmortem chemistry, Thanatochemistry, blood, carbohydrate, glycogenolysis in liver, glucose diffuses in nearby vascular channels, increased glucose in vena cava and right side of heart. Spurious postmortem diagnosis of diabetes mellitus may be made. Right atrial blood is sampled, which contains glucose diffusing from glycogenolysis in the liver. Glycolysis in the postmortem period occurs at a rate of 12.8 mg per 100 ml per hour. However, blood glucose levels are not useful as a postmortem indicator because of several variables: diabetes, cause of death. Increased glucose levels occur in asphyxia, carbon monoxide poisoning, increased intracranial pressure, lactic acid during life, and plasma and RBC levels 1 milliequivalents per liter after death, 20 milliequivalents per liter, 12 to 24 after death, 50 to 75 milliequivalents per liter. Nitrogenous compounds, creatinine, non-protein, and total soluble protein, all linearly with the postmortem interval. Amino acid, nitrogen up to 10 hours after this. Other organic compound, cholesterol and lipid. Cholesterol does not show any change up to 90 hours after death, irrespective of whether the individual has a low, normal, or high level during life. Other lipid substance, total serum fatty acid, total lipoprotein, and beta lipoprotein show very little reduction due to autolysis. Bilirubin first 2 hour increases at a rate of 0.2 milligram percentage. At next 20 hour increases at a rate of 0.7 milligram percentage. In icteric individual, however, the levels have no appreciable change. Enzymes all shows increased after death. Acid phosphatase within 48 hours levels increased 20 times. Alkaline phosphatase increased with the postmortem interval. Normal antemortem range 1.54 to 4 Bonsky in unit. 10 hour after death 5.3, 18 hour after death 9, 48 hour after death 30 BU. Amylase after 2 days levels are 3 to 4 times that of normal antemortem level. LDH, SGOT and increased linearly with the time first 60 hour. Hormones cortisol levels remain constant for first 18 hours after death. Values range from 13 to 26 microgram percentage with an average of 18.4 microgram percentage. Electrolytes, sodium level decreased at a rate of 0.90 milliequivalents per liter. Chloride level decreased at a rate of decreased occurs through intracellular shift. Potassium level increased to 80 milliequivalents per liter after 1 hour due to its release from cells. Thereafter, continues to increase gradually, occurs even in a blood stored in blood bank. Calcium levels are constant up to 8 hour, 10 hour. Thereafter, it increases. Phosphorus, both inorganic and organic phosphorus increased after death. After 18 hour, inorganic phosphorus is also increased up to 20 milliequivalents per liter. And in a CSF, about 15 ml is removed through LP section. Specimen of choice in child abuse case when eyes are to be examined histologically. Carbohydrate glucose decreased very rapidly after death. Lactic acid increased sharply and regularly up to 10 hour. Thereafter, continuous increase but at a lower level. Inositol normal level during life increased regularly after death with levels reaching up to 72 milligram percentage. Electrolyte, inorganic sulfate stable up to 3 days after death. Potassium increased in a proportion to the logarithm of time up to 70 hours after death. Shorup's formula. Shorup's in Dermar studied the changes in CSF, lactic acid, and non-protein nitrogen amino acid, developed the formula. Vitreous interpretation. 2 eyes are made up to 10% carbohydrate glucose. Normal vitreous glucose levels are approximately half the serum level. With the increasing postmortem level, there is a constant decrease in the carbohydrate level. Within 4 to 5 hours, levels are 0 in non-diabetic. Lactic acid normal values are 18 to 160 milligram percentage. After 20 hours, they increase to 110 to 260 milligram percentage. Electrolyte calcium normal levels are 54.95.5 milligram. Postmortem changes to insignificant to any help. Chloride level are 114 millimole per liter. Changes are too insignificant to be of any use. Magnesium normal levels are 18 to 30. After death, it increases at a very slow rate of 0.03 milligram per annum. That's very little value. Potassium found to be more useful so far. During life, potassium concentration is low in vitreous humor, but much higher in peripheral tissues such as retina. After death, the potassium from peripheral tissues, retinal cells, and vascular choroid starts diffusing into the vitreous, increase in concentration. This occurs in linear fashion. Formula most popular in this regard at time since death: 7.14 into potassium minus 39.1, that is Turner's formula. Time since death in hours: 5.26 into potassium minus 30.9 is Muddy's formula. Three formulas are there: Turner's formula, Muddy's formula, James formula, with the help of the potassium. James formula 4.32 into potassium minus 18.5. Sodium levels are 2480 to 3500. Postmortem change is too insignificant to be of any help. Hypoxanthine is formed by hypoxic degradation of adenosine monophosphate and increased during the postmortem antemortem hypoxia. However, it is also increased after death in a linear fashion. Normal vitreous level 7.6 micromole per liter. Pericardial fluid, more quantities 10 to 15 ml can be obtained as opposite to 5 ml of CSF and 1 to 2 ml of vitreous. Potassium increase at an average rate of 0.30 mmol per hour. Sodium decrease at a rate of 0.37 mmol in the first 85 hours after death. Calcium does not change appreciably after death. Synovial fluid, levels of sodium, potassium, calcium chloride, urea, creatinine, glucose in synovial fluid show that they behave in the same way in vitreous. The range of all values is compared with other fluid. Time course of the glucose and potassium concentration is very nearly similar. If no vitreous humor is available, synovial fluid may be used for determining postmortem interval. Thank you.